And then for the surveillance objective, identify emerging clusters to facilitate granular instead of blanket lockdowns. Again, start with the objectives, then the case definition, then how you're going to monitor, or how are you going to collect the data, who's going to be responsible for it, and what happens, collect that data. So some lessons learned from our experience with Philippine factories remaining open. First of all, the declarations are ideally done before they even go to school, or for the teachers before you go to work. They're not declare it when you're there, you're sick and you're on site, right? So it should be ideally even before you go to the site. Second is that the larger burden will be in the contacts. Usually the cases are few, but it's really the close contacts, or the contacts that are a lot. And these contacts may be from the workplace, or from school, within the school setting, or from home. We observe cross-contamination of cases across factories, and therefore this can happen also across schools in the same municipality. So number 4, be friends with your LGU and your neighboring schools. Number 5, in workplaces, and the school is a workplace, leadership, the human resources, and clinics really make or break the company's culture of surveillance. If you will prioritize it, if you're gonna do it rigorously, okay? Then number 6, have a lens of disaster risk reduction. So like in the same way that we have drills for earthquakes, for fires, later on, we should have this kind of drills also for schools, for pandemic settings. Although we already had 2 years of of online learning, okay, but yeah, that's something you can consider. Okay, you know, in other countries, like in the National University of Singapore, where I studied, even before COVID, they had simulations of a pandemic in a how they would do online learning. Why? Because they experienced it with SARS. So after that, they really learned how to, you know, prepare for a pandemic crisis, because they experienced SARS. Yeah, so the university, even if SARS was already resolved, they had programs where they say, okay, we will have a drill 1 week online learning there. So they had that kind of programs. Okay, go digital. Number 7, set up real simple dashboards to monitor absenteeism cases and contacts. Well, maybe if you want to do it on Manila paper, that's okay as well, as long as it is timely, okay, and accurate. And then issues will be things like return to work or return to school and quarantine protocols. But the policies for this are, you know, they really become fluid over time, right? So we will just have to align with whatever IATF says. Well, in 2020 and 2021, there was they did some mathematical modeling for testing and tracing, like what would be the best ways to control if we do testing and tracing, like how exactly will we do it. So there are mathematical models for that. And in the models, they said that, like in one France study, they said, yes, we can do regular tracing and testing to isolate cases and social distancing. And then for UK, they said we have to increase testing, we have to do, we need effective contact tracing and isolation. And in China, they said that, yeah, we can open schools with masks and everything, but if we don't do contact tracing, that's going to increase the cases. So they demonstrated that contact tracing is really important. And then US, their modeling says that, yes, well, they should do in tracing, face masks will also be beneficial. So there. So there were mathematical models like that. And okay, so this is just a general outline of biology, bites, and behavior across different countries at that time, 2020 and 2021. What they required in order to reopen schools. There. So yeah, they check temperature, they require testing, they do lockdowns. Japan has no blanket closures so that flexible decisions can be made. And then us, we had our self-assessment to prepare for pilot implementation. I know you're quite familiar with this already. School safety assessment tool. Yeah, so bites, testing, and tracing in schools. There are, so in other countries, there's contact tracing, testing or increased testing there. Then we have behaviors, safety nets, behavioral nudges, collaboration, and cooperation. Promoting a culture of health and safety. You can have the most detailed policies and tools in this, but it is equally as important to ensure that the protocols are reasonably easy to implement. Cultivate community considerations rather than stigmatization of disease. Do not punish those who are sick. So what's work in local factories? There are gamification in health declaration, meaning the more you declare, I mean, if you declare regularly whether or not you have symptoms, that's considered a raffle entry. Group incentives for timely reporting, for compliance to protocols, and for vaccination. So you see, it's good, no, not individual. Like, okay, so this section, this floor is now 90% vaccinated, so we will give them this bonus, you know. So it's group incentive. Then there are also designated employees or staff as physical distancing monitors and health champions. There should also be appropriate disciplinary measures for violations, ticketing, MMDA style. And then there are also groups that does community ayuda, or co-workers send food to isolated or quarantined employees. Safety nets. Okay, so safety nets is the reassurance that absences due to illness will still be paid. I mean, this is for employees, of course, that you will not be punished for being sick, because you know, sickness is a biological thing that is really part of life. So you should not be punished in a sense for that. Okay. Now, when the safety nets was laid by factories, this was the single most effective intervention to decrease cases and net productivity loss, because now people were honest about what they were feeling, and this decreased the risk of transmission within the workplaces.